Hey guys, welcome to the season 2 of Curl Up Mukti podcast. We are your host, Tushang Bhardwaj.
And Michelle Singh Olaf.
We are the inner voice that tells your story,
Our
our story.
story.
So, Michelle, are you excited to kickstart this new session of Mukti's podcast?
Absolutely, Toshang. This season will be packed with some amazing and insightful sessions for all of you.
Hi everyone, I am Dr. Vijaykumar, Senior Interventional Cardiologist, also Associate Professor in Cardiology, Sri Jaideva Institute of Cardiovascular Sciences, Bangalore. So I welcome you all for this small session on little bit knowledge about the cardiovascular diseases in young.
Yes, sir. So my first question will be, what are the lifestyle factors that contribute to increased heart diseases nowadays, especially among the young adults?
Yes. It is a very relevant and very important question here, because when we see the media or now, we can see a lot of information, or we are getting lot of deaths among young people. We hear that some celebrity has died of heart attack, some person at 20 has died of heart attack. See, these all are due to our lifestyle changes. When we see from our ancient times till now, as we start becoming more modern and ultra modern, our lifestyles have become really worst. See, the lifestyle things like are very important. One is smoking and exposure to the tobacco smoke, either active or passive way, is one of the very important risk factor. Drug abuse, then sedentary lifestyle and lack of physical activity. So as I told, another important thing is family history of any hypertension, diabetes or cardiac issues in the family. Very important, as we are going more modern, it is the work stress, chronic stress and mental disorders. We are exposed to so much work pressure, or whether it is from the childhood, that whether we have to be in the first, we have to be in the race. These are some of the pressures which are very important. And not least important, very important, is air pollution. We would have seen an article published recently in Times of India 2 days back also. So we are losing our effective life of 5 to 10 years depending upon the amount of pollution we are exposed to.
So what are the diet changes that you see nowadays? People moving into all the junk food. Are those factors also contributing to
Definitely
increase?
yes. I forgot. Poor dietary habits are very important role. See, as we know that most of us, we don't know that, okay, I am 18 years, I am 10 years, I don't get heart attack. It is not that. See, generally when you see how the disease of atherosclerosis, what we call heart block, so this develops from the birth itself. So it starts as a small fat deposition in your arteries. So this will start from your after birth itself. All these things, whether how much it grows when you have an heart attack, depends upon your lifestyle changes and diet. See, what you were saying, junk food, which contains lot of cheese, high calorie fat, trans fats, which are very harmful to our health. And most of us are addicted to artificial sweetener drinks, soft drinks, which contain high sugars with high calorie with which are very harmful with high sugars. So these all will increase the deposition of fat and increase the blockage in the arteries. This can happen directly due to that, or secondarily due to increased calorie consumption, you start gaining weight. So adolescent obesity, because children are exposed to this fast foods and processed foods, which leads to increased weight gain, obesity, which in turn is a risk factor for diabetes, hypertension and cardiovascular disease. So this is how the diet is leading to many of our cardiovascular diseases.
Correct. So we talked about obesity. So what's the correct amount of weight that a ideal teenager have?
Yeah. See, generally, when I am as a cardiologist, when I see the patients, general common question is, sir, what is the ideal weight for my age? See, this is not the right one. See, it is not calculated for the age. We usually calculate this by taking your age and height, what we call it as BMI. It is a body mass index. So we calculate by weight in kgs divided by height in centimeters square. Generally, this value should be somewhere around 18 to 23 is the normal range, and some up to 25 we can consider. Anything above 25 is overweight, above 30 is morbid obesity. This is how we calculate obesity.
And so, how is stress and mental issues, especially
Yes.
causing all these?
Yes, it is a very, very important thing. So, one of the, as I forgot to say in the lifestyle changes, another important thing is adequate sleep, which all people are lacking. They think they give very least importance to the sleep. See, generally, we advise for our body to regenerate or to maintain healthy one, we need 7 to 8 hours of sleep. At least 6 hours of sound sleep is advised. So, due to this modernization, late night parties, late night binge watching on gadgets and movies, people have forgotten 6 to 7 hours of sleep. See, that is one of the thing. I need to know that question once again.
Okay, sure. So, yes, the question was that. So for now, like you were talking about 7 hours of sleep daily.
Yes.
So is it like continuous 7 hours of sleep, or would like 5 plus 3?
Yeah, ideally it should be a
work?
continuous one.
Okay.
If not possible, at least that whatever 6 to 7 hours you sleep should be sound. In that you should feel refreshed.
Correct.
That is how. Because people may say that I sleep 3 hours in the night, or they may not get. When you get up in the morning, you feel fresh.
Correct.
You should feel fresh. That is what we call it as sound sleep.
So we're also talking about the pollution in Bangalore or
Yes,
air pollution in
yes,
general.
yes.
So what are the causes behind that, and like how can a normal person prevent those to protect themselves?
See, this pollution is happening mainly due to vehicles, construction, and burning. You see, Delhi is very close to the Haryana, where a lot of farmers, after they rise or these things, wheat, that one will be burnt, and that releases a lot of toxic gases into the air. So that is one of the main reason. Other thing is vehicles. We see a lot of vehicles. We see in Bangalore, each house has got 2 to 3, 4 vehicles, each person. So these vehicles also contribute to major part of the air pollution. And other thing is construction, the dust and toxic materials are released during the construction. So these are major things which contribute to the air pollution. So recently we have actually done a study in traffic police in our institute, Jaidava Institute. We have seen that slightly higher prevalence of coronary artery disease in patients with the traffic police, because they will be continuously exposed to the pollution, air pollution. And I think so recently, I think yesterday or something on social media, I saw a post suggesting that Delhiites are losing approximately 10 years of life due to air pollution. So this is what I have seen 1 or 2 days back. So this has come into picture last few 3 to 5 years. We are giving more importance on air pollution.
So what is the role of air purifiers now that we see those are coming up and a lot of brands are advertising? So are they useful?
Maybe we have to study, but definitely if they are able to reduce the impurities and levels of toxic gases or amount we are exposed to air pollution, definitely they will be helpful. But we need studies or some to prove that whether they are very much effective to prevent air pollution related deaths.
Perfect. And so when we were talking in the very beginning, we were talking about the athletes that are getting heart attacks and weightlifters mostly when they're lifting weights.
Correct.
So what are the reasons behind that?
Yes. See, I was going through it just to know whether any few celebrities, while I want to talk about this. If I hope, when I typed it as athletes or some sports person with sudden cardiac death, from 1922 till now, I had some thousands of people.
Correct.
So this, what we say athletes, generally we have both congenital and acquired heart diseases, which are responsible for this sudden cardiac death. Congenital is, there are many channelopathies, we say that, like heartbeat related conduction abnormalities, are acquired in the form of heart muscle being very high, thicker, or some form of heartbeat irregularities are responsible for this. See, these manifest basically at rest, they may not be able to manifest in the same way. When you exert, so especially exercise or high intensity sports, body is exposed to higher stress, higher heart rate, and higher blood pressure and other hemodynamical variables. which the diseased heart or person who has these things are not able to sustain. That is how they are happening. Many times you would have seen that football player having a sudden death
Correct.
or athlete having a sudden death. So these are all due to this genetic and acquired heart diseases. So generally, European Society of Cardiology is one of the higher society for us, like American Heart Association. So this recommends that over 12 years of age, any child or wants to participate in a competitive sports, better to have their cardiac evaluation done, and then onwards every second yearly. This is ideally recommendation, but we don't know how many of them are following.
Following.
But generally we say, if you are planning for an high intensity exercise, there are some people gym rats or some people who wants to do a high intensity exercise. So I suggest them to have cardiac evaluation before they go for this high intensity exercise, especially persons who have strong family history. See, if they have father or mother, father having a heart disease below 55 years, or mother having a heart disease below 65 years, or any of their siblings or first degree cousins having the cardiac issue, they should definitely undergo evaluation before they go for
All
any
these sports.
exercise protocols or sports.
Correct, sir.
Hmm.
So now we're talking about family history.
Hmm.
So, sir, like, is heart attack one of the things to see? In that?
Yes. See, we actually, for this family history, definitely it is known many times. If you ask 10 or 20 patients out of heart attack, at least 8 to 10 people will say that my father had an heart attack or mother has an heart attack below this age. So, but in young people, there were not much many studies. Especially, we have Western studies about it. And last 3-4 years, we have one wing called premature coronary artery disease wing in our Jaidava. We have done a research articles below heart attack in young below 40 years of age. Among them, we see a lot of patients have family history. And another thing is smoking.
Correct.
These two were very rampant, and other things which we have noticed is high cholesterol.
Okay.
So these are the factors which have come out in major quantity responsible for coronary artery disease in India.
So we're talking about smoking. So what about vaping? Because a lot of people think that vapes
Yes,
are
I know. We
Correct.
know that it has been banned in India. Still,
Correct,
people
sir.
use this vape. See, vape, electronic cigarette, that is also almost equally harmful. Like what you do with other smoking. So it is not safe.
Yes.
That I am using vape, I will be protected from the heart disease. No,
Correct.
nothing like that.
Yes, sir. And so we're talking about family history also. So, sir, a lot of people get confused between whether they're having BP attacks or is it the heart attack. Like my own Nanu, which is my mom's dad, he got a heart attack, but they thought that it was a BP problem, so they did not take him to hospital all of a sudden, and then he had to.
See, generally, what was the presentation when he had? You told BP attack. What symptoms he had?
So I'm not really sure,
Oh.
but this is the story that we are told.
See, there are something called as warning signs or some of the signs which indicate possibility of heart disease. If a person complains of a chest pain or discomfort, some person may say that I have something feeling heavy in my chest or something burning in the chest associated with pain spreading to the left upper limb, arm, and upper back up to the jaw. Or some person says that I feel this heaviness when I start walking, or I walk in uphill, or when I'm climbing stairs. But once I stop, I feel better if I take rest. So, or some person say indirectly having a throat discomfort. When I walk, I feel something is catching here or burning. So these are different ways how person can manage. Any of these symptoms, you should be thinking. It is a very watchful that these are the indication of coronary artery disease. Otherwise, person says that I was able to walk 2 kilometers earlier. Last 1 week, I am not able to walk 500 meters. So I am getting easily exhausted, or I am feeling dizziness on walking, or I feel some irregularities in my heart rate, or I feel some swelling of my ankle feet, or I started doing excessive snoring in the night. These are some of the soft signs and symptoms of suggesting that it could be some form of cardiovascular disease.
And so also we were talking about these exercising and all.
Mm.
So now people are moving into yoga. So like, are there any exercises that a normal person should do to like make their heart stronger? If that's something.
See, generally, always from our side, we suggest moderate activity, even moderate intensity. High intensity, never do immediately.
Mm.
You have to acclimatize your body first. So go gradual. See, whenever you want to do, generally anything, a brisk walk or a mild jog
Mm.
for 30 minutes in a day, 5 times a week is sufficient.
Okay.
This is what we recommend. So if you are able to exercise 1 hour is okay. Generally, we say go slow.
Mm.
There are people who start exercising for 2 hours, 3 hours, lifting very heavy weights, and they have collapsed in the gym or while jogging with high intensity. So these things should be avoided.
At the very beginning.
Yes, yes. Gradually get yourself, before doing that, get your cardiac evaluation done, then go gradual. Never go initially first day or second day doing a high intensity which requires very high calorie or very high, which will burn high calories. So that generally is not safe.
And so now we talked about exercise. So what about the food habits? Like, what
Mm.
are the foods that a person should consume?
Yes, yes, yes. See, generally, as I told, this food habit should be taught to the children from the
Very
a very young age itself, from the parents. So always you should promote healthy snacks and healthy diet. Generally, what we say is any food which should not have more salt,
Mm.
more oil.
Okay.
See, one more common question is, sir, which oil I have to use?
Yes.
So that is like a marketing strategy. They say rice bran oil, sir, I use combined oil. See, generally any oil, if you are using in a limited quantity, is safe. So try to eat as much fresh fruits as much as possible in your diet. Include lot of vegetables in your diet, less dairy products,
Okay.
and you
less
have to use
dairy
more
products?
cereals. Yes, yeah, more cereals and pulses, whole grains. Never use more processed food or very fried items, because these fried items will contain a lot of trans fats. So those things you need to avoid, and junk food outside. Eating frequent junk food is not allowed. If you want to have non-vegetarian, we advise you to have an egg white, less yellow part, because it contains little more
Yolk.
cholesterol, yolk, and salmon fish. Seafoods are allowed. We ask them to perform or use in the form of gravy rather than fried,
Yes.
because that consumes less salt, less oil. Skinless chicken sometimes we advise. Red meat has to be avoided, because that contains lot of fats and cholesterol, which is responsible for heart disease, stroke, and other issues.
So what about wine? Because wine.
Yes. See, they say alcohol in moderation is a good, but generally, if you say this, patients start taking
lightly.
regularly and lightly. Red wine, they say, it contains a lot of antioxidants and flavonoids, which is good for heart. But anything in excess is
Bad.
bad. So in a mild, moderate amount is okay. Occasional social drinking is fine.
And so also a lot of people have heart holes from the day they are born. So like,
Yes.
so are there particular causes for it, or like?
Yeah. See, that is what we call it as congenital heart diseases. There are so many different types of holes which can be there. Some are very benign. They can be closed even at many times. We see patients coming at 50 years, first time getting their echo done, and see that is also there. These holes also can be little bit malignant at the birth itself, but generally most of this one will be not life threatening. There are some holes where there will be mixture of both oxygenated and deoxygenated blood. Those are life threatening. Those will be causing little difficult for the baby growth. They should undergo multiple surgeries. Some may not even reach adulthood. So that is how it should be evaluated immediately.
And so what about the pacemaker? Because that's also new technology and all. And like 40 years back, my grandfather had that operation, but at that time it was not available in India. So he had to go to US to get his
Correct,
surgery done.
correct.
So like, how far have we come in those domains?
Yeah. See, this pacemaker is nothing but generally in our heart, to generate the heartbeat, we have something called as SA node, which is a natural pacemaker, which will produce the impulses, makes the heart beat around 60 to 100. That is normally. So what happens as you start aging, that undergoes degeneration. It starts becoming weakening. So then your heart may not be able to beat at the same rate. You may have 30, 40, and that is a problem of aging. That is how your grandfather would have had. So in that case, we keep something called as the electrical lead inside the heart with the battery, which will produce the impulse and make your heart beat. So we can adjust the rate, 60 or 70 or 80, whatever the desired heart rate. So based on that, it will beat. And that battery lifespan will be around 8 to 10 years, depending upon how much your heart energy is used, consumed. So if it is after 8 years, you can replace the battery.
Oh, okay.
So this is very common scenario. There are some other scenarios we see when there is some other infection or other diseases, or some, this is how we see heart attack. We have something called as congenital heart, complete heart block, which we see at younger age.
Oh, okay.
So those patients also, it is a treatment of choice.
So
Now
what
we are doing it left. Right? It's not like earlier. It has gone beyond now.
So over your course of practice, like what are the changes that you see in your patients? So like, are there more younger people that are coming up with heart diseases? Or are
This is definitely required one, because people should be aware. Generally, what happened when I was doing my MBBS and MD, I used to see heart attack at 50, 60s.
Okay.
When I was doing my super specialization in cardiology, it came down to 40 to 50. And after that, 30, COVID.
Correct.
After that, we have started seeing at 25, 20.
Yes. So
That
many
is has become very common. The decade of onset has coming down. Earlier, which was a disease of 60 years, now we have started seeing at 20, 25. So for us, it has become so difficult when some person comes at 20 also says chest pain. It's difficult to ignore and say that you don't have. So minimum basic ECG we are doing. And earlier itself, if you see the Indian genetic composition compared to Western, we are one decade earlier in getting the coronary artery disease. So now after this COVID and other lifestyle and modern, we are seeing
It's
at
further
20, 30s. It has become common.
So you talked about like Indians having it at an early age. So what is the cause behind that?
See, that is a genetic composition itself we see. There are some types of cholesterol and varieties of cholesterol which we are more prone to develop coronary artery disease than this. And our diet also is very important. If you see Western, they use little bland and not much spices and salt or something. If you see our diet, we'll have all nice masalas with multiple spices, which should taste well.
Yes, sir.
So all this, and oil consumption also will be more when you're using along with that. So this is one thing. Geographical variation will be there, and genetic cause. So multiple things come together to say have one decade earlier.
Yes, sir. So how do you think parents and educators like promote healthy heart habits among children and teenagers especially?
Yeah, that is what I was telling you. There is separately, you need a nutritional education to the parents and kids. In the school also, they should introduce this nutritional education, and parents should go on teaching them from the childhood. So what is good for you? What are the nutrients? These are good, these are bad foods. So that is how education should start from them.
So right amount of sleep, right amount of food.
Yes.
Changes in
Yes.
exercise.
Diet though, it should be like a continuous process. What will happen initially, you may be like, when we say educate, you feel okay for 1 month. Then when you see the food, junk food, you get tempted. So it should be like a continuous process of educating the person. So because you are exposed every day to many of the foods everywhere. When you go through one street, you see a lot of different stuff where you feel tempted to have the food. So
especially we all are living in PGs and we are away from home. So like those are definitely contributing to it.
Definitely. That is what nutritional education should be like continuous process till certain age. After adults, it is difficult some patients to whether they will take or not.
So also many fast food joints are claiming that they have healthy food options like healthy pizza and cheese. So, like, what are the
Generally, that is even though they claim it is not, it contains definitely a lot of fat and cholesterol than this, and there are something called as good fats also. So there are like ghee, cow ghee, whatever we eat. Now we generally say it is better than what you use outside refined oil or those things. But cheese and all, na, still I feel the amount of goodness
that
and harmfulness, if you say, I don't suggest those stuff what they claim also, I don't suggest.
Okay, sir. So, sir, what about the carbonated drinks? So, like our Fantas, Pepsis, and Coca-Cola.
They are really actually very harmful. See, they contain lot of artificial sugars and lot of calorie. See, that is the one of the reason for increasing in the obesity. If you go to the Western countries, you can see always people walking with a big cup with either Fanta or artificial this drinks, and especially this what you are saying, pizza or healthy, whatever they think. Because of this, there is rampant increase in the obesity. So this obesity is leading to all the events: diabetes, hypertension, high cholesterols, cardiac issues are happening because of that.
So, what about coffee? Like, is coffee a healthy solution to
See, caffeine, they say that is good for the heart in a moderate amount. Anything more, because caffeine has it acts as a stimulant. It increases your heart rate. It increases your blood pressure. Yeah, it also simultaneously increases your alertness. That is why people start taking coffee.
So, what is the like amount that they should take? Like morning one or evening?
Generally, that is very difficult. We say that at least twice a day with a minimum amount they can take it. Not more than that.
And what about tea, sir? And there are another varieties of tea, like white tea and all coming up.
Green tea. They say that generally green tea is good for the weight loss because it also contains many of the antioxidants. Even for the cardia, it is good. So other tea, I can say once or twice, maximum, not more than that.
So now moving into electronic bits of it. So like Apple watches and other fitness watches and bands are coming up, and they're claiming that they'll provide you tips on how your health is, your heart health is. So like, what is?
See, this Apple Watch is doing one way better and another way it is harmful also. See, there are sometimes it picks up the event where you are having a heart rate of 180, 200. In some cases, patients, I have seen, especially software people coming, sir, my heart rate morning was 120. When I came in the evening, it was 90. See, it has caused little more panic also among them. It has both beneficial and this. So, but definitely sometimes it can pick up the events and it can also have this.
And so, what about the checkups? Like, how regular should a person?
See, generally, we say that if a person has a diabetes or hypertension, strong family history, or any of the risk factors, ideally, yearly once getting most of the checkups is better. If no symptoms, at least 1.5 yearly is also okay. But diabetes, hypertension, I suggest better to get it done every yearly once.
So, from what age? Like, starting from what age the person start?
There is no particular age as such. You see, most of them they say because I have reached 30 years or I have reached 35. So generally, what I would suggest is even at 12 years, if you have any issues, or 18 years once you get, if nothing is there, you can get your checkups at second or third year intervals. So once you cross the 35, 40, better to get it done every year, at least 1 year.
So can we discuss on CPR?
Yeah. This is one the life-saving procedure, emergency procedure. CPR stands for cardiopulmonary resuscitation. This is a very important life-saving one, where if you see this can happen or you can have encountered these sort of things anytime in your lifetime. Suppose when a person suddenly collapses, even you can see him, immediately you should always feel for his hand, pulse, breathing, and if he is conscious or not, make him alert. So if he is conscious, single person, otherwise if he is unconscious, you call for help, someone here. So C stands for compression, A stands for airway, and B stands for breathing. So always your hand should be like this, one over the other, and kept over the center of the chest, and you have to give a push where it should go 1.5 inch inside and come back. So every 30 times, one breathing should be given. You have to, while giving the breathing, you have to keep his chin up and close his nostrils and mouth to mouth breathing, or if you have other facility that can be done. So this should be repeated until he gets conscious, till some aid comes from the hospital or the ambulance. So this should be aware, because this is a very important thing. Many times you can save a lot of people. Yes, lot of lives you can save.
So many youth or youngsters are having panic attacks and anxiety attacks. So is it related to heart, or like is it related to mind? And what are the causes behind it?
See, anxiety is not related to the heart, it is related to your mind. So what happens, person suddenly gets frightened, there will be release of the hormone, especially epinephrine, adrenaline, non-adrenaline and cortisol, which will suddenly make him increase his heart rate. He starts sweating excessively. He feels that something is happening in it. So this is very common nowadays among the young people, especially because of work stress, targets, lack of sleep, bad lifestyle and poor diet. So these are the common things, very commonly we see related to this. Chronically exposing to the anxiety may cause cardiac disease because of chronic increase in the heart rate and hormonal variation.
But there's no direct link.
No direct link as such.
So any ending remarks that you have for the youth or the younger generation?
Yes. See, the thing is, cardiovascular disease has increased very rampantly compared to earlier. So it is no where a disease of 40s or 50s or 60s. We are seeing even in 30s and 20s. So very important is manage good lifestyle changes. Exercise at least 30 minutes a day for 5 days a week. Keep yourself active. Never get addicted to your gadgets or to the system and become physically inactive or sedentary. And also you should have eye on what you are eating. Proper diet. Avoid junk food. As much as possible, try to eat a healthy diet and regular exercise. Avoid chronic stress. That is in your hands. Stress can be managed only by your regular management of your work schedule. Give some time for exercise, if possible for your mind exercise by yoga or meditation. So never go directly for the higher competitive or intensive exercises before cardiac evaluation, especially when you have strong family history or other histories of diabetes, hypertension or any other comorbidities. Maintain ideal body weight as far as possible and get regular health check at a regular interval to prevent cardiovascular disease. Thank you.
Thank you so much.
So that's it for today's podcast.
Hope you all enjoyed the show.
But wait, stay tuned for our next episode, which will be out soon. Till then, stay safe and keep calm.
The podcasts are available on your favorite streaming apps, including Spotify and YouTube.